triple-negative breast cancer is an aggressive form of breast cancer that more predominantly affects young women and African American women. Today, we often approach triple-negative breast cancer by giving chemotherapy first, and then patients will move to surgery next. What we found is about 1 in 3 patients will have their entire tumor melt away from the chemotherapy, so that when they go to the surgery, it's all dead scar tissue. This is what we call pathologic complete response. And as you might expect, that third of the population does extraordinarily well, with about 90% of them being cured. Conversely, the other 2/3 that have residual disease that's removed at the time of surgery have a much higher risk of relapse and death. So about half of these patients will have recurrence.
So what's scary is for these patients who have residual disease, we know that they're at high risk of their cancer coming back, but we really don't know which patients' cancer will come back and which will not. So what we did in this particular study is use a really innovative technology where we could take a simple blood sample, use really sensitive techniques to be able to detect tumor DNA in the circulation of these patients. If we detected tumor DNA, what we know is that their cancer is at high risk of coming back. Conversely, if we don't see any tumor DNA floating in the circulation, those patients did really quite well, with 90% of them still disease-free after 2 years. Also, a really neat thing about this study is we incorporated another new technology called circulating tumor cells. So these are actually live tumor cells that float around in the circulation. They're released from tumors somewhere resident in the body. So we were able actually to look at both in this case, how ctDNA and CTCs may work together to determine which patients will relapse and which will not. What we found in our study is that if patients were positive for both ctDNA and circulating tumor cells, they had considerably inferior outcomes, so their cancers were very high risk of coming back. However, if they were negative for both, 90% were cancer-free after 2 years. Genomic technology like cell phone technology is getting cheaper, faster, and smaller. And really the technology to be able to do this was only made available just a few years ago. And even there, it's been rapidly advancing. And so our capability to even look at tumor mutations in plasma is only something that's been capable in the last 3 years. What I think we're proud of here at IU is that we're already applying this for clinical care. We're using this actively for our patients here at the IU Simon Cancer Center as well as in clinical trials, and we're proud that we're really providing our patients the most cutting-edge technology available.